Hi, welcome to Workshop 2 in 3. Today we're going to talk about care plan and evaluation. Care plan is an essential part of nursing process where the actual or potential problems or affected ADLs are identified. The objectives of care are established, and we'll do this in partnership with the patient. The station will start with 1 minute to read the scenario overview. In this case, Mia Qatar was admitted for investigations and endoscopic procedure, and the scenario asks you to pick up the two most relevant aspects of nursing care and self-care suitable for the next 24 hours. Note that it is today and it's 9:30 a.m. We will start with our nursing problem or need. Nursing problems provide a focus for planning and implementing effective and evidence-based care. This process consists of identifying nursing-sensitive patient outcomes and determining appropriate interventions. It's also about determining the immediate priorities and recognizing whether patient problems require nursing care or whether a referral should be made to someone else. After this, we will also identify the aim of care for the patient, noting that what the patient will be able to do, making it achievable and measurable. The use of measurable verbs that describe patient behavior or what the patient says facilitates the evaluation of patient outcomes. A few examples of measurable verbs are state, verbalize, list, describe, demonstrate, to reduce, or to increase. After that, we establish the re-evaluation date. How often will we evaluate? How often will we check on our patient? Now, the trick for the re-evaluation date is relating it to common activities in our daily nursing routines. So there are two documents that are used in clinical practice that will assist you in establishing a specific and measurable re-evaluation date. One of those documents is your observations chart, your news score. For every nursing problem that is physiological in nature, we will check on our patients and reevaluate that problem according to the frequency of monitorization. So our reevaluation date will be the frequency of monitoring. For example, for a news score of 2, our reevaluation date will be every 4 hours or sooner if required. If the problem is in nature related to an activity, there is another document called the intentional rounding tool that is used to check on our patient on an hourly basis to ensure patient safety. With the rounding tool, we check on mostly activities of daily living like mobilization, toileting, eating and drinking, personal hygiene. So if the nursing problem is going to be activity-based in nature, our re-evaluation date will be hourly or sooner if required. After establishing the re-evaluation date, we will now establish our nursing interventions and our patient self-care activities. Now, patient self-care activities go hand in hand with our interventions. The question you're asking yourselves when filling this part out is, for this intervention, what will my patient be able to do for himself, or what is the level of assistance that the patient requires? Let's see a few examples. So as we can see, our nursing problem for Mia will be Mia needs to be safely prepared for the upcoming surgical procedure. Now this relates to the reason for admission, and we know that Mia was admitted to have an endoscopic procedure. Our aim of care is going to be to complete safe preparation for surgical procedure using a measurable verb. And our re-evaluation date is going to be hourly or sooner if required. And for this one, I've considered the frequency of the intentional rounding tool. My first intervention is going to be obtain informed consent prior to any interventions. And for this, Mia has capacity to consent effectively. So I'm establishing what Mia can do for herself. My second intervention is going to be to monitor Mia's observations, including vital signs, whatever the frequency was, according to news, and escalate as per news. And Mia is able to cooperate with the observations. Educate Mia on the therapeutic plan and administer any relevant medications as prescribed and assess their effectiveness. Now, Mia understands her treatment and complies, and she also verbalizes effectiveness of medications as appropriate. So we're establishing what Mia can do. Ensure call bell is within reach at all times and educate on its use, and she has understood and is able to effectively use her call bell. Now, the first 4 interventions are going to be pretty much the same for any problem. These are those interventions that have to be there because they're all about informed consent, monitorization of vital signs, interdependent action as in administer relevant medications, and giving out the call bell and therefore ensuring patient safety. From now on, I'm going to give you a few examples of interventions specific for this problem. So ensure Mia understands the importance of fasting prior to the surgery and respects the nil by mouth status. And Mia can understand and respect the need to stay nil by mouth. Complete preoperative checklist with Mia and ensure compliance with protocol. Mia participates in checklist completion and can comply with the protocol. Ensure Mia has signed the surgical consent form prior to surgery and refer to the surgical team if it's not completed. And Mia has the capacity to consent and can report if this has been done. Provide health education and reassure Mia regarding upcoming procedure. Mia expresses her doubts and verbalizes reassurance. And that is a comprehensive example for this first problem. Our second nursing problem is going to be based on our assessment. So in this part, I'm assuming Mia is anxious about the upcoming procedure. Now, it's important to define what is the source of the anxiety because that will affect our interventions and it will make our care plan specific to this patient's problems. So Mia is experiencing anxiety due to, could be the upcoming surgical procedure, could be because she will encounter financial problems due to the recovery time after the procedure, while she will not be able to work, or could be that Mia has a pet, like a dog, at home and no one to look after it. So all of these can be sources of anxiety, and we're going to establish which one is affecting me at this point. Our objective is going to be very short and simple, to reduce Mia's anxiety, and we are going to reevaluate hourly or sooner if required. Now in this case, I've assumed that since I am checking on my patient every hour with the intentional rounding tool, I'm also asking her how she's feeling. But it could also be acceptable to use your frequency of observations, because anxiety can also show in an increased respiratory rate or increased heart rate, therefore can show some physiological signs. So as you're going to see, our first 4 interventions in self-care are going to be pretty much the same as they were on the previous one. And these 4 are relevant for every problem. So specific for this problem, the first thing we're going to do is reassure Mia regarding the source of her anxiety, and Mia is able to express herself. We're going to teach and encourage Mia on deep breathing exercises, and Mia is able to engage on deep breathing exercises independently. Now this is where I've established Mia's degree of dependency. If she wasn't, then I would say something like Mia engages on deep breathing exercises with mild or moderate assistance or requires full assistance. Encourage Mia to engage in diversional activities. Now note the verb that I've used, encourage. And the reason I've used it, it's because we're going to encourage Mia to do something because she is able to do it independently. If she required assistance in achieving or performing a certain task, we would say assist instead of encourage. And the self-care, Mia is able to select and engage in diversional activities independently. Educate Mia on what to expect and relevant care post-operatively, and provide health education leaflet relevant to her case. Mia is able to understand and read the leaflet. Now here is where the reason for Mia's anxiety is going to affect the way I'm going to establish my interventions. So if Mia's source of anxiety was the surgical procedure, I could refer to the surgical team for reassurance regarding the surgical procedure. If it was because of financial problems, I could refer to the social services for financial advice and assistance. If it had to do with a pet, I could refer to the city council or to pet welfare for them to assist Mia with her pet. These are the most common examples. Another one you might want to consider as well is refer to the chaplaincy team for emotional spiritual support, especially in situations that are causing a bit more of an emotional strain on your patient, like a termination of pregnancy, for example. And for all of them, Mia will be able to consent for the referral and is able to discuss the issues affecting her with the relevant professionals. So this is the example for the care plan. I hope it was clear, but again, if you need some more clarification, don't hesitate to ask one of us. We do appreciate it's a lot to take in. Now, the second part of this video is going to talk about evaluation of care, which will be the last station of your APIE. Evaluation of care is represented on the OSCE with a transfer of care letter. So the safe transfer of care is a vital component of quality of care and safe practice. It is dependent on optimal communication by all team members, and when inadequately undertaken, risks to the patient are increased and may subsequently lead to harm, which is why it's so important that your documentation is impeccable on your evaluation of care. And we'll look at what is required of you now. So the same as with planning, it will start with 1 minute to read your evaluation overview. Ms. Mia Qatar has undergone her procedure. Recovery was uneventful. Mia was diagnosed with a small peptic ulcer and is now being transferred to the pre-discharge lounge. We are going to complete a transfer of care letter to ensure that the receiving nurses have a full and accurate picture of Mia's history and needs. It is today, and it's 17:30. So looking at the inside of the transfer of care letter, we're going to start by describing the reason for initial admission and subsequent diagnosis. And this information can be found on the admission booklet on the top. Make sure you copy both of them. Both the admission, reason for initial admission, and the diagnosis. The next thing is going to be the date of admission. Now be really careful here not to jump ahead and start transcribing the nursing needs, because that's when things get missed and then you failed because you forgot to write down the date of admission. So date of admission would be today. We are then going to identify the main nursing needs addressed. So these are the nursing problems that we picked on and that we wrote about on our care plan. Mia needs to be safely prepared for a surgical procedure, and Mia is experiencing anxiety due to the upcoming surgical procedure. Now, the little caveat here is that this transfer of care letter is post-op and it's going to go to the discharge lounge. So we need to make it relevant for the people that are receiving the transfer of care letter and our patient. So we are going to add 2 or 1 nursing problem to make it relevant for them. So in this case, it could be post-procedure requires safe post-procedure care. The next step is going to be outlining the nursing care provided, and we are going to do this by copying all of our nursing interventions from our initial care plan. So as you can see, I've copied everything, but I've put it on the past tense. So we're talking to our colleagues in the discharge lounge and we're telling them what we did. Now, if we have added a third problem or a fourth problem to make the nursing needs more relevant to the people referring the transfer of care letter, then we're going to add one or two interventions, again, to ensure continuity of care upon the transfer. So in this case, post-procedure care could be anything around remaining nil by mouth immediately after the procedure, and introduce liquids and then solids slowly. Could be assess for pain and nausea regularly and offer medication and assess for medication's effectiveness. So anything that would relate to this new problem that we have identified. But it doesn't have to be extensive. One or two, just mention what is really, really relevant for that immediate post-procedure care. After that, we're going to copy the self-care from our nursing care plan. So again, I've copied everything that I've put on my care plan. And you will note that I've divided the space and that I've used the blank spaces on the document, so on the margins. So just write wherever you can in a way that it's legible and complete. That's not a problem. Documented allergies will be both in the nursing admission document and on the implementation chart. So just copy the relevant allergies and associated reactions. And then we're going to think about health education. So specifically for this patient, we could be thinking of things like managing esophageal reflux at home, post-procedure care, importance of follow-up with GP, diet and healthy lifestyle, benefits of smoking cessation. But again, like I said, could be anything that is relevant for this specific person, even if it's related to their past medical history and not to the current problem. So this is the end of your planning and evaluation video. We hope you found it useful. I'm sure there will be a lot of questions following these examples, so don't worry, we will have an opportunity to discuss all of them at the beginning of your APIE workshops. Just make a note of them, or alternatively, email one of the clinical facilitators and we will be more than happy to help you with them. All right? So, see you in class.